We are back. It is episode 10 of the Stay in the Game podcast, and I am your host, Trevor Field, physical therapist and owner of Form and Function Physical Therapy in Rancho Cucamonga, California. Hey, welcome to the show. We've got a great one for you. We've got our staff updates, office updates, topic of the month that you're going to want to stick around for. If anybody's suffering with balance or vertigo issues, you're going to want to stay tuned for this. We're going to cover the product we love, our health tip and trick, and the monthly promotion, and answer your question of the month. So stay tuned for that. Let's get right into it. So it is February, and getting kind of excited for this Super Bowl. Kind of a surprise matchup with Cincinnati Bengals coming out of nowhere to be the AFC representative. And the talk really has been a lot around Joe Burrow, but their quarterback. One thing I haven't heard much of is just how recently he tore his ACL. So if anybody's suffered with knee injuries, torn ligaments, reconstructive surgery, you understand kind of what a process it is to get back. But for an NFL player to get back at the highest level, to be able to compete in the Super Bowl, this is somebody who mid-season last year took contact to the legs, ruptured his ACL, went straight to surgery, and went right to work. So he came out bright and early in week one and took down my Vikings, surprisingly. You could tell he just wasn't 100% yet trusting in his knee, but you could almost see it from week to week, his confidence really getting restored. So a lot of people will say, hey, look, we can really get this thing rehabilitated, get your full range of motion, and get strength back within, as little as 4 months. But most will tell you it can take up to the second year after a major knee surgery for you to really fully recover. And what I mean by recover is that you feel confident in it, that you know and can trust that that knee will support you if you cut, pivot, run, jump, land. So really, that's what we're seeing with Joe Burrow right now. He's getting past that point of that hesitancy in his knee, and you're seeing him run around with almost reckless abandon and forgetting that he had a knee injury to begin with. So things like understanding where your joint is in space, that's something called proprioception, and something we're going to talk a lot about today with our balance topic of the month. So stay tuned. Can't wait for you to get into some of that content. So with it being February, the things we're seeing a lot are our transitional athletes, those folks just starting up spring sports a lot. So we're filling the schedule to a level that we haven't seen since March of 2020. So it's been exciting times. Things are getting busy. We like the hecticness of the clinic when we see that schedule just jam packed. So we're hopping, busy, happy, and helping people. So brings us a lot of energy to the clinic. You guys bring a lot of that energy and positivity to us. So we appreciate y'all out there. One other thing that I wanted to kind of tell you that we're seeing much of that it's been a little different. I think has had a lot to do with some of these COVID lockdowns and people just not moving around as much are folks with balance issues. Vertigo in particular, but just balance in general, I'm seeing it's really been altered in a really fundamental way. So I wanted to get into the topic of balance and vertigo for this month and discuss kind of the root causes of where vertigo comes from and balance issues in general will come from. So let's get right into it. So the first I just wanted to hit is vertigo. What is vertigo? People hear about it, they just think they're dizzy. So vertigo or dizziness in general, dizziness can come from a lot of different places. Blood pressure, dehydration, standing up too fast and you get what we used to call as kids a head rush. Well, that's more a blood pressure issue, things that will spike for a moment and then kind of level back out. So you'll see it spike, then rapidly drop, and that's where you feel that issue of dizziness. What I'm looking for is more of kind of an inner ear. Vertigo comes, one common one that we see in our office is something called Bppv, or benign paroxysmal positional vertigo. So that will happen if you're looking up too long or have a quick spin, turn quickly, and your body starts to react with a tremendous amount of dizziness. Incredibly debilitating. It can really kind of shut down your life for a while. So a lot of people don't know that physical therapists actually treat it. But the source of this vertigo issue in the inner ear is actually something called otoconia, basically calcium carbonate crystals that develop in the semicircular canal of the inner ear. Well, the function and structure of that semicircular canal, it's a fluid-filled structure, a canal, that on the inner surface of it has these little hair cell receptors. So you see when you move, that fluid of the inner ear of the semicircular canal will flow across those hair cells. And you can almost visualize when movement of fluid moves across these little hair cells, that hair cell begins to move. Well, that gives the inner ear feedback that movement is occurring. So you could see even in a completely darked out or eyes closed situation, your body will be able to sense movement even if the visual system is kind of turned out. Well, what will happen is now if we've got these little calcium carbonate crystals bouncing off the hair cell, there's going to be conflicting information. So that conflicting information is really what sets off this cascade of dizziness. And you'll see even the eyes begin to bounce in the head. It's something called nystagmus. It's a kind of common clinical symptom. So if somebody's describing dizziness issues, they moved rapidly, and you see a friend or family member turn, but you see their eyes almost beating one direction, just very rapidly darting side to side. That's something called nystagmus and could be a clinical indicator of Bppv. And that's somebody who we can treat very rapidly. So even in the acute stages of this, it usually either sends somebody to the ER or urgent care, and they just do a lot of palliative care anyway. They may give you like a motion sickness pill or some other type of medication to suppress that motion sickness feeling or movement, when it's a really simple fix for us to do something called an Epley Maneuver and actually go through a series of head movements that'll move those little calcium carbonate crystals from that semicircular canal away from that sensitive area. So if we can move those little calcium carbonate crystals, stop them from banging around on these hair cells, then a lot of the vertigo symptoms will be gone almost instantaneously, even within a couple hours. So yeah, I'd love to help you guys out because, like I said, it can be incredibly debilitating. So if you know somebody who's suffering with Bppv, send them our way. A quick manual movement assessment can tell you if it is truly an inner ear or if something else may be going on, and get treatment instantaneously. So we discussed vertigo and kind of the inner ears component of it, but really balance comes from multiple locations. So we discussed kind of that vestibular system or inner ear being a backup if you were in a dark area or had your eyes closed or in fact you were blind. So the visual system also really gives the body and brain a ton of input to tell you where you are in space. Obviously, being able to see the horizon, know where you are, and understand kind of and process that information. It's another kind of checkpoint that your body uses to kind of have those checks and balances to know where you are in space. It's why people tend to focus on a point when they're dizzy, and it tends to help just to center oneself and be able to at least know and focus on that point will bring some of the symptoms of dizziness back down and get back under control. But one of the things that a lot of people don't know is that the joints have their own little position sensors. There's little stretch sensors that tell the body where that joint is in space. Things like here's some fun anatomy terms. The Golgi tendon organs. These are little receptors that assist in telling the body where the joint is in space. So those can be part of skin, nerves, and otherwise. So things like wounds, things like scar tissue, things like stiffness across joints can really begin to alter your body's perception of where you are in space. Well, one of the most common injuries we see in our office in athletes and things that it's outside of kind of low back pain, ankle sprains are incredibly common. So anybody who's suffered an ankle sprain, we've stretched some of these tissues out. And if we haven't worked hard to restore proprioception, what will happen is later in life, you'll see a really significant reduction in balance. So I tend to see folks in their 50s and 60s and older that actually had some history of one or more ankle sprains that they never really got addressed. They'll have significant balance issues throughout that entire chain of their body, not just at the joint, at the ankle joint, but all the way up the chain, and see effects in the hip and lower back that really could have easily been solved if they just done a few sessions of maintenance physical therapy just to make sure that, the joint was good. Once the pain and swelling went away, they went back about their life thinking that they were back to 100%, when in fact there was some underlying issues that now are rearing their ugly head in terms of, hey, I want to hike, but I find myself tripping, or they're just not confident when they get on the grass or uneven ground. So definitely something that it's an understood factor that goes into how your body processes balance, but something that most people didn't know that you could actually improve on. So I wanted to throw that information out to you because in all of these cases, physical therapy can help. Now, I mentioned PT can help, but we also need to know why it's important that you would want to go to a PT to deal with some of these things. And obviously, almost all of us has known somebody in their elder years who have fallen, broken a hip, broken a shoulder, broken something. And it tends to be a devastating end-of-life injury. And my goal is to really extend life and extend the quality of life as long as possible. So if there's something that's easily preventable by just getting in and learning a few drills, a few exercises, a few tips and tricks that can assist with improving your longevity and reducing kind of pain and suffering, well, of course, I want to bring that information to you guys. So if you've got elder parents who may not be moving as well as they used to, even though you think of us as more of a sports facility, this is something that we see frequently. So we'd love to help you out. So how can PT help with these balance issues? Well, the very first thing is we're going to assess. So we're going to figure out what the source of some of these deficits might be that are causing the balance issues. It could be something as simple as ankle mobility strategies. They may have a hip mobility or strength issue that might be affecting how they can shock absorb or move confidently. It could be just that they haven't moved enough lately, and all of this weakness or stiffness has really begun to alter their ability to move well. It could be a vestibular issue. It could be a coordination of all of these systems working together. So it could be something that we've got to work on: visual drills with movement, challenging the proprioception of the joints while also challenging some of the inner ear. So first thing is just figure out what's going on and why. And there's some kind of clinical findings that you could even assess yourself or assess a family member who might be struggling with balance issues. And the first is just one of the key indicators that I look for in high fall risk is somebody who's starting to shorten their stride length. So somebody who's become so unconfident in their walking that you start to see their walking strides really begin to shorten. It almost looks like they're walking on ice. So they're almost like locking up all of their tissues, flat-footing their gait so they can have more input into the ground, not even rolling heel to toe, shortening the stride length. So if you've seen any of that with a family member, those are kind of key indicators that a fall might be in their future if they don't get an intervention. So keep an eye out for some of these things. So we have many patients who have come to us with these kind of issues. So the one that comes to mind most recently is an elder patient. His husband actually brought his wife for several sessions to really get her to move again. See, she was, they're a nice German couple who lives locally to the Rancho area, and he was really concerned because they were wanting to take a few trips back to Germany, and because of the cobblestone streets, he was not very confident that she was going to be able to just walk around the local community, because it's not just a simple paved sidewalk. They've got some ancient towns back in Bavaria where they were from, and it was it was really cute. They were a great couple, great family, and she was really motivated to get back and see her homeland. So we worked hard with simple drills. We worked hard with some mobility exercises, hands-on manual therapy, stretching, building up her strength and endurance to be able to tolerate the flight and all of the walking that she was going to have to do. And it was about a 6-week process for us to build things up. And you could just see in terms of, well, the first thing that came out of her husband's mouth when I asked how he felt like she was doing, he said her pace of walking increased so much that he was beginning to have a harder time keeping up with her. Before, he was almost getting frustrated with how slow just even getting through the store was, or getting out and having an evening walk. But now, after even just as little as 6 weeks of conditioning, strengthening, balance program that we had put together for her, he was struggling to keep up with her, and he was thinking himself about getting into a few sessions just so he could keep up. So it's something that we can see a rapid improvement in with a whole lot of hard work and dedication. So you've definitely got to be somebody who's motivated to get this work done. You've got to have that thing. For them, it was, I want to get back to Germany. You got to find that one thing. I want to do something, because usually motivation is, and having that goal is the thing that's going to help set you apart from somebody who just has tried something, but it just didn't work. And as far as a recent Bppv patient that we've had, I've actually had one of my wife's childhood friends reach out to us, that just DM'd my wife on Instagram. And it's always fun when both of us are in the medical field. We just randomly get DM'd or reached out to about basically anybody's physical condition. So it turns out she was referred over to me through my wife, and she was in the middle of a pretty gnarly Bppv episode. The dizziness was pretty severe, so much so that instead of making a left to go to ER, she took a right and made it over to our office, and her husband dropped her off, and her symptoms were incredibly easily provocable. So it was one where once we did our what's called a Cannalith Repositioning, basically these, we mentioned the calcium carbonate crystals, that repositioning of those calcium crystals, we allowed her system to kind of calm down and chill out for 20 minutes. And she went home, and the typical follow-up is I'll check in the first 24 hours after, said she was doing great. Second day, back to work, driving, feeling back to 100%. Now, this was something for her that had lingered almost a full week of her not being able to drive, lay down in bed, turn over without really just a raging kind of head spin issue where the room felt like it was kind of wobbling on her. So really, I love treating those, because you can certainly almost be somebody's hero for as bad as they're suffering and how simple and quick the fix can be. It's really gratifying as a therapist, and it's really relieving as a patient to get rid of some of these awful symptoms. The treatment of it, I can't express to you more that I would love to help get some of you guys away from the suffering of Bppv. The covering it up with medication is not the way. We've got to figure out how to mechanically move those calcium crystals. So if you know anybody suffering with vertigo, dizziness, we'd love to assess them, get them out of that pain and suffering that they're dealing with, the pain of missing out on things, the pain of like the nervousness, the anxiety that being dizzy will cause you. Because literally it's tough to walk. You can't drive. You can't work. It wipes you out. So send them over. We'd love to have them. And to kind of put a bow on our topic of balance for the month, I wanted to kind of leave you with this little nugget. So we will commonly do an annual physical or a checkup or do some of these things to make sure the cardiovascular system, the heart, your eyes, your ears, you get to your dentist to make sure your teeth are in proper shape. Would it be such a bad idea to do an annual physical checkup with a physical therapist, a movement expert, to make sure your joints, your old injuries that you've had in your life have been, more thoroughly explored, to make sure that there's not imbalances in your body that'll creep up in your older age that could turn into a balance issue or a fall? So even if you yourself are doing well, we'd love to have you. So we've kind of launched this annual physical program with that kind of end in mind. So if you're looking for just a general checkup, basically a multi-point inspection to make sure all of your body systems are functioning the way they need to, I'd highly recommend getting into that annual physical program. And if you've got parents, grandparents, elders, the neighbors that might be dealing with some of these balance issues and they're in the middle of it right now, just let them know that there's things that they can do for it, and refer them our way. We'd love to help them out. We'd love to make sure that we have a healthy, stable, standing, not falling community for years and years to come. So, thank you for in advance all of the referrals that you're going to send over to Form and Function. And that brings us to our product of the month, and that is the Balance Bubble. So this little disc is really something we use on a near daily basis. Certainly with all of our ankle injuries, anybody who's got balance issues would really benefit from some of this. But this Balance Bubble is it's a really multifaceted tool, I'll tell you. So there's things that you can do in terms of sitting on it, focusing on your core, focusing on ankle and lower leg stability and balance. But if you've ever used one, you'll know the benefits. And if you haven't, you're going to need to find out. So this is, you can pump this thing up to modify the challenge that you'll get with it. But we've actually put together a few simple video strategies of things that you can use with it that if you purchase it through our website, formfunctionpt.com/recommended products, that we can get you all of the information you would need to improve the balance, stability, coordination of some of your movements. So check that thing out. We'll have it launched not only on our page, but you'll see some of our more recent posts on social media. So if you're not a current follower of us on Form Function PT on our Instagram or Facebook, go check us out there. You'll see some of these videos and see exactly what I'm talking about and why this is one of the other more versatile tools that we use on a daily basis in our office. And now it's time in the show where we cover our health tip and trick of the month. And since it's been all about balance, we're just going to stay hammering that topic out. So we talked about balance not just being a vision or inner ear problem, but a joint feedback loop problem at times. So I'm going to give you a quick little tip that you can really challenge some of these joints to help you tune back in. So what you're going to do is get into the kitchen or somewhere where you've got a nice high countertop where if you do lose balance, you've got something to hang on to or catch yourself. So if you're struggling with balance, I want to make sure you're in a good, safe environment. But I want you to put your feet together and take those hands off of the countertop. And I just want you to close your eyes. Now, in that balanced position, we're going to lose that center of gravity, that base of support. We're going to narrow that base of support, put those feet together, and we're going to just close your eyes. Now, I want to see and have you feel how much you feel like you're swaying. The goal is to feel like there's very minimal sway. And if there is sway, not so far that you're going to have to take a step to catch yourself. Now, a goal would be just setting a kitchen timer for 30 seconds and see if we can get there. A bigger goal to get to a full minute. But there's other alterations of this that you can do. So we can challenge the inner ear on top of that, where we can tip your head side to side while those feet are together. We can turn your head left and right while those feet are together and your eyes are closed. So modify that, challenge yourself, and see how you do. So give me some feedback. I'd love to hear how you do with this tip and trick and see if we can't improve some of that balance. And one of my favorite parts of the show is to bring you the promotion of the month. So the promotion of the month, obviously with February, we've got the month of love, Valentine's Day. We want you to bring someone you love. So if you haven't been in a while, you just want to get a tune-up, that tune-up session for you is going to be at a special rate of $70. But if you bring a friend, that friend is going to get that assessment for free. That's right. You're going to bring a friend for a free eval, and you're going to get a special tune-up session for as little as $70. So this is going to be a big one because I honestly just brought this up, had launched a quick little post about it before we recorded the podcast, and I've already had a few people sign up. So I think this is going to be a huge one for this February. So bring them on in, bring a friend. Make sure that you get your loved ones taken care of for this month of love. And that's all I got for you people. Thank you so much for tuning in. I want to get your questions answered on live on our podcast. So please send me your questions. If you wanted to know anything about anything related to your health, your balance, your strength, your performance in sport, I want to hear your questions. If it's back pain, neck pain, shoulder pain, ankle pain, injuries, surgery recovery, anything at all that you're wanting to know about, shoot me your questions. We want to get them answered right on our podcast and get it on a platform where we can get more ears to hear it. So send us your question. If you've got it, I'm sure hundreds and thousands of other people just like you have that exact same question that they need answered. So shoot them off to me. Send them to me at info@formfunctionpt.com. Here we are, signing off, episode 10. Thanks for listening to the Stay in the Game podcast. Hey, like us, follow us, subscribe. We're at Form Function PT. And don't forget, send me your questions. We want to hear from you. Have a great one.